We know that here in Manitoba, many First Nations have declared states of emergencies, particularly around mental health, as well in reference to the opioid crisis, and very much making it clear that there is a lack of mental health supports in First Nations, in Indigenous and Northern communities across our region. According to the Canadian Journal of Psychiatry, compared with other children in Manitoba, First Nations children in Manitoba had a higher prevalence of mental health illness and disorders. We know that hospitalization rates for suicide attempts were twice as high in reserve than off-reserve First Nations. And when the comparison cohort was restricted to only other children in low-income areas, a higher prevalence of almost all disorders remained for First Nations children. This didn't just happen. This is because of Canada's history of colonization. This is because of the persistence of intergenerational trauma, whether it be through residential schools, the child welfare system, ongoing institutional racism that exists in our country. It's also because of poverty. Nowhere is the housing crisis more acute than on First Nations here in our country.